Hi, this is Shy. You are listening to the mayor of the airwave. Who loves you, baby?
Hey, good morning, everybody. How you doing? We are live with Dr. Steven Sinatra, MD, is one of the most highly respected and sought-after cardiologists whose integrative approach to treating cardiovascular disease for the past 4 decades has revitalized patients in even the most advanced forms of illnesses. He's going to discuss with us today how the coronavirus is a concern to our health. Good morning, Dr. Sinatra. How are you, sir?
I'm great. It's a great morning, isn't it?
It's a beautiful day in paradise. Great day to be alive. So tell us there's a lot of fear going around, Dr. Sinatra. The other day, I was in my car. I picked up a coffee from Dunkin' Donuts. As I sat in my car with the window down, a lady came up to the window and started yelling at me, "You were supposed to have a mask on." And I'd had a mask on in the store, but I'd pull it down below my chin to start sipping my iced coffee. And she started screaming at me, and I said, "I have a mask on." And, of course, I immediately told her to get the heck out of here. You're scaring me, you know. People are fearful.
Yeah, exactly. And remember, when people are fearful, it creates panic. And during panic, I mean, people can do unpredictable things, like, be irate, I mean, being verbal is one thing, but when somebody starts pushing somebody out, I remember I was in a supermarket in Florida, and the same thing happened, So it's the times we live in now, and it's unfortunate, but if there are rules and regulations, I would say it's better to just follow the program and just go forward.
Well, I myself, I love people, and all of a sudden I found myself, I actually swore at her, and then I had 2 ladies in the car, and I apologized, and I said, I immediately did self-analyzation. I said, "Why did you get angry?" And I thought, because she scared me. Fear, anger, exactly. Fear or hurt talking. And I was obviously fearful, this woman just suddenly being in my window, dictating what I should be doing, and secondly, pointing the finger wrongly. But this COVID-19, obviously, is causing a lot of anxiety in a lot of people. You're a cardiologist. Is there any truth that something about high cholesterol which is good for me because I'm a high cholesterol guy, that it can actually be good at fighting off this virus?
That's an interesting question. And Dr. Johnny Bowden and I, we just upgraded The Great Cholesterol Myth. It's a book we wrote about 5 or 6 years ago. And, cholesterol is an interesting, fat because we have it in our body, right? And remember MRSA staph, how devastating that could be? Well, this is a problem, especially in kids, and it can be lethal in kids, just like this virus can be lethal in anyone. Mm-hmm. But children who have the highest cholesterols are protected against this virulent staphylococcal infection that can, really cause death. So it's kind of interesting. And then when we did the research on cholesterol, we realized that it can protect patients from gastrointestinal infections. And I was part of the Framingham study years ago here in New England. And basically, some of the cardiologists that were running that study became psychotic because, after decades, it was realized that the people in Framingham, Connecticut, who had the highest cholesterols were living the longest. So there's something about cholesterol that's associated with longevity. Now, I'm not talking about the people that have familial hypercholesterolemia. These are people that have inborn errors of metabolism where the cholesterol is a 6, 7, 800. That's dangerous. I mean, I'll concede to that. But somebody like myself or yourself who may have cholesterols of 250 or so, I don't see any problem with that at all. And somebody's going to do this research, Rhett, but it could be protective against, infectious disease and possibly this virus. So, I'm not worried about people with higher cholesterols now, especially in this day and age.
Well, I remember my friend Bob Tillich was studying to be a neurosurgeon when I was 20 years of age. Of course, I'm 66 now, so that's quite a while ago. But I remember he told me, he said, "We absolutely know conclusively that eggs are bad for you. Eggs are bad for you." And I swear, 10 years to the day, they came out with information saying, "No, we've decided eggs are good for you as long as you eat the yolk with the white, the combination, and blah, blah, blah."
Well, I mean, there's been studies on this. I mean, if you eat even 4 or 5 eggs a week, and that's a lot of eggs per week, It doesn't seem to really budge your cholesterol levels. Remember, your body makes cholesterol, and that body makes it for a reason. I mean, cholesterol does so many good things for the body. You know, it lubricates the skin. It forms vitamin D. I mean, my gosh. I mean, you know, the cholesterol in your skin and the sunlight actually form vitamin D, which is, you know, vital in this virus. I mean, cholesterol is vital in the formation of our sex hormones. I mean, and it forms bile, which is vital for the GI tract. So cholesterol does a lot of good things in the body. Why we want to kill it, why we want to reduce it, is the subject of major controversy. Wow. And that's why Johnny Bowden and I wrote The Great Cholesterol Myth, because it is a myth when it comes to heart disease.
Now, I've not had I'd like to have your book. I don't have your book yet, but it's The Great Cholesterol Myth, and it's still available on Amazon.com and everywhere.
Yeah, it's still, but, you know, I would wait until we have a new edition coming out in October, you know.
Okay.
We've updated it. You know, and I'll tell you, while we're on the subject of cholesterol, there was a big meta-analysis that came out of Europe. This is only last week. This is amazing, where they looked at all these studies, these clinical studies. And when I speak of it like this analysis, they took at all these studies, and they came up with a conclusion. And the conclusion was basically that over the last 20 years, you know, cholesterol lowering with high-powered pharmaceutical drugs may not be reasonable. I mean, it can reduce the possibility of death in people with known cardiovascular disease, but the numbers to do that are minimal. In other words, does it do some good? Yes. And my premise on this is this: if you're a male with established coronary disease and you're under the age of 75, I don't see any reason to take a very, very low dose, you know, cholesterol lowering drug like a statin. But I chase it with a lot of coenzyme Q10, because remember, statins are cholesterol killers. They also knock out CoQ10, which is part of the cholesterol pathway. See, that's another vital component of cholesterol, because it's in that same pathway where the body makes CoQ10, which is vital for life. So, you know.
Well, no, I don't know what CoQ10 is. I've heard of it, and I've had people suggest I take supplements. Where do we naturally get CoQ10?
Naturally? Well, probably the best place is beef. You know, it's CoQ10 is part of the animal kingdom. I think fish, sardines are a great source of CoQ10.
Oh, I love sardines.
Migratory salmon. By the way, sardines do a lot of good for the body. If you love sardines, they're loaded with CoQ10. They're loaded in what we call DMAE. This is sort of like a chemical that's involved in the brain that's involved with acetylcholine. And they also have peptides, and these natural protein peptides in sardines that can actually lower blood pressure. So if you do have high blood pressure, which is a comorbidity for COVID, by the way, you know, eating sardines is a good thing because it has a lot of lowering of blood pressure. Also contains a lot of calcium. So sardines are a great little fish to eat.
Let me ask you this now. Years ago, a Dr. Jackson in Vero Beach, Florida, the late Dr. Jackson now, he got cancer around his ear. He was constantly on his phone. He and I did an interview like you and I are doing an interview. We became friends. He ended up advertising, I guess, CCP treatments on my show. And we became friendly. I had an ache in the jaw one day, got a phone call that a reporter, old guy that I knew, had died on the weekend, had gone to the hospital thinking he had a toothache. His aorta blew out and he died. The sheriff called me on Monday, and I said, that's ironic. I have an ache in my jaw. I called him. I said I knew he wouldn't charge me. We'd become friends, and he was a sponsor of my show. I said, go in and see him. I was always reticent to go to see doctors when I was in my mid-40s. But anyway, so he puts me on high blood pressure pills, which I'm still on. But anyway, he put me on a statin, and I woke up in the morning, and it felt like my back was a piece of wood. One thing I do is I listen to my body, which can subjugate the authority of anybody, no matter how highly educated. I took myself off the statin immediately. Now, my father ended up in a nursing home in Vero Beach, Florida, and I ended up seeing this lady who was a great listener to my show. She was a high-intellect individual, and I went in to see her, and she was all curled up, face up, looking at the ceiling with her hands gnarled up. And I said, Ruth, how are you? And I would visit her. Finally, on the third visit, I said, what happened to you? And she said, statin drugs. Statins did this to me.
and they froze up her body. And I've got an 88-year-old friend who's had a good life. She's an author late in life, still very active, and her doctor put her on statins recently. I'm going, I don't know. I'm not comfortable with these statin drugs.
Well, you're absolutely right. I mean, statin drugs are like a blessing and a curse. I will tell you this. A low-dose statin, I'm talking like 5 or 10 milligrams. I'm not talking like 80 milligrams, these massive doses of 40 milligrams that a lot of cardiologists use. But a low-dose statin, they do some good things, Brett. One thing they do is they thin the blood, and I like thin blood. That's why I'm a big proponent of grounding and walking barefoot, because that thins the blood. And
let's say that again. Where are we walking barefoot? What?
Yeah, walking barefoot. We wrote the book Grounding. We did a lot of the research on walking barefoot. I mean, walking barefoot on the beach is one of the healthiest things you can do,
really?
Especially when the surf comes in. Oh, absolutely, because you're taking in the human energy of the earth. Especially Florida, but around the equator and Florida, because it's sort of like the area of around Tampa. It's sort of the lightning capital of Florida. But around the equator, the lightning strikes the equator thousands of times per minute. It's just amazing. So the Earth gets endowed with a lot of electrons, and these electrons get absorbed through the feet, especially if you're walking on grass or concrete. Certainly brick is fine, but the beach is the best because of the tide coming in and the minerals, et cetera, et cetera.
Really?
Taking this human energy from the lightning strikes, and this is like taking handfuls of vitamins and minerals. So this is one of the best things of not only calming the autonomic nervous system, but we did the research on it. It thins the blood at the same time. And in this COVID area, in this COVID area we're living in, or the 21st century, we have red ketchup blood, whether it's due to insecticides or pesticides or heavy metals or sugars or our diets. I mean, it's all of the above, but one of the best ways of reducing, heart disease is thinning the blood, and grounding or earthing, walking barefoot does that. I mean, that's you can take that one to the bank. I mean, that's awesome information to have. So if any of our listeners like walking barefoot, hats off to them. They're doing their body a lot of good.
There was a Dr. Peter Holick. As far as I know, he's retired. At least he got scared when I guess Obama got elected and moved down to some islands, non-American islands. But anyway, he had cancer when he graduated as an eye surgeon, and then within 3 or 4 years he got cancer, which he survived. But after brain surgery, he had a shakiness in his hand and could no longer perform eye surgery, which is kind of hard on a guy who spent 30 plus years studying so he could be an eye surgeon. But anyway, he got into alternative medicines. And one thing he did do is he told me every day he had an office in Vero Beach, Florida, and then one up in Sebastian. And he would, in the middle of the day, he would go to the beach, he said. He would kick off his shoes and socks and stand in the water for a few minutes.
That's earthing and grounding.
Yeah.
He's doing it.
Yeah. And at that time, I was maybe in my early 40s at the time. And I was just dealing with this new stress. And which a lot of us are under. I think somehow we learn to cope as we get a little older. How old are you, by the way?
I'm 73. I'm 73, but you
sound like you're 55.
Well, with all the supplements and in this day and age of self-healing, 70 is a new 50. You got to look at it that way, Rhett.
You get a kick out of this if we get to be friendly down in Vero Beach. I have a friend of mine. He co-hosts my show on Fridays. His name is David Walsh. He's 94. He started his real estate firm, having been in the car business all his life. He started the real estate firm when he was 80. He's still running his real estate firm at 94. Comes and co-hosts my show on Fridays. Does his own show on Wednesdays at 11:30 a.m. on my station here. And the guy's just a marvel. But every day he gets up and he moves first thing in the morning.
Right. Well,
anyway,
movement is good.
But he's 94 and a clarity of mind. So it shows you. I mean, it's commonplace for centenarians to come on the show now, celebrating their 100th birthday. So this is wild. So now is this stuff like walking on the beach and stuff? Is that covered in your book on cholesterol or no?
No, but that's in a grounding book. But I'd be happy to send you both of those books. When I go to the office, I'll take your address after the show, and I'll send you those books. I mean,
now, are you still active in your practice?
No. The only thing I do in my practice, Red, is years ago, when I was practicing on a day-to-day basis, I would see a lot of kids with congenital heart disease who needed heart transplants, and a lot of them I put on my program of CoQ10, and I would use D-ribose and magnesium and carnitine. And this was my metabolic cardiology approach. And a lot of these kids, this is interesting, some adults, their hearts healed, so to speak, where they didn't want heart transplantation when the heart was offered to them. And, I don't see patients on a day-to-day basis, but when I'm back in Connecticut, I do see some of these children who are into adulthood now, and they still have refused heart transplantation because they're doing really well on a metabolic cardiology program.
Okay, I wanted to ask you, first of all, this is kind of cool because having been in this business for 25 years and conducted over 40,000 interviews, you're not, obviously people don't realize it, but you don't make money on books. And so you're doing this, obviously you're doing, I want them to know that it gives more validity and credibility to everything you're saying because you're doing this altruistically as a doctor, wanting to help people and validate your life, right?
Exactly. I mean, that's the greatest thing that gives me comfort is knowing that I could share my experience with others and, others get well. One of the worst things about becoming a doctor, but what it is? It takes decades. I mean, decades to learn healing. Yeah. It really does. Yeah. And, when you're 60, 70, 80, you probably really get it, how to heal people. But then you're at the end of your life. So that 90-year-old plus guy, I mean, hats off to him because, I know some of my doctor colleagues, they're in their 80s, and they're awesome as healers, I got to tell you, because, it's like anything else in life. Experience is the key to going forward.
There's no doubt about it. I understand, I want to speak about politics just for a second. It's like these term limits. People wonder why I'm not for term limits. I got to tell you, folks, when I was first on the radio, some lady called the station and said, get that guy off the air. He doesn't know what he's doing. So it's taken me years to learn how to be a decent interviewer. I hope I am, and to do what I do. Same thing with the doctor, like you said. For those that are younger, even late in life, I'm at the age of 66 right now. But I got to tell you something. My quality, though, of what's important to me has totally inverted from what it was 15 years ago. And the same thing with the doctor, with accumulated knowledge. We should do a string of shows. I should do a string of shows with older doctors that are seasoned, and I think it brings more credibility. But we'll talk about that in the future. Right now, I want to talk about the vaccine for COVID-19. What about the validity of a vaccine? What do you think? Because you were a young boy during the development of the polio vaccine. What can we learn from the history about the effectiveness of vaccines, Doctor?
Well, that's a good question, Red. And like cholesterol, a vaccine could be a blessing or a curse. I mean, there's no doubt about it. During the polio epidemic, I was about 7 years old, and I remember kids in my grade school in wheelchairs. And I remember on my block that I live, I had people, behind me, in front of me, afflicted by polio. So when the Salk vaccine came out, we all got it. And it was an incredible blessing, I have to tell you. I mean, because my parents were afraid of children getting polio, especially in my neighborhood. So let's switch over. Let's go 50, 60, 70 years, into what's happening, in the United States now. Could a vaccine be a good thing? Absolutely, especially if it doesn't have side effects. We won't know, going forward. But, one thing about this virus that I do know is when I speak to my colleagues, we have to give this virus a lot of respect. And the reason being, it's absorbed through the lung, through the mucous membranes of the nose and the throat. It goes into the lung, and the virus locks into receptor sites in the lung. But these receptor sites are also involved in the heart, the GI tract, and the brain. We call them the ACE2 receptor. And I have never in my lifetime seen a virus like this because it's multisystemic. So it attacks the myocardium, it attacks heart cells as well as lung cells. So if there's a vaccine that comes down the pike, I would strongly consider it because there's no other alternative unless you live a very, very clean life. You don't get exposed because one of the things I learned about this virus, it's very, very contagious, And, 20 to 40% of people can be sort of semi-symptomatic. In other words, they have a low-grade fever. They don't know it. They might have some sore throat. They might have a runny nose, but they're not sick. And they're performing okay, but they can
Are they carrier?
Spell the virus. They can carry it and give it to others. And the age group this is sort of like the age group from maybe 12 to 19, where they could carry the virus. And so if a child in that age group hugs grandma, and grandma is in her 70s or 80s, and she has a diminished immune system, it could be frightful.
Yeah, but also the other day I read about where some little girl got it, and by the morning she had it, and that night she was dead already.
Yeah,
breaking the hearts of her parents.
Yeah, that's the problem with this virus. And so, I pray that a vaccine is safe. I mean, again, vaccines can cause problems. They can be problematic. I know the government's going at warp speed on this. I think that's probably one of the only, remedies we have at this point.
Masks?
People are coming out with nasal sprays where they can maybe neutralize the virus. There's so many things that people are developing right now. But right now, I think if you do a low-sugar diet, you take vitamins and minerals, you get some exercise, you do the social distancing, you stay optimistic. You do not want to become a sad sack. In other words, optimism breeds health. You don't want to be pessimistic. And, you do these little things. And I think the most important thing, Rhett, is if you're like 25 pounds overweight, I think losing weight during this epidemic is absolutely essential. Even if you lost a mere 5 or 10 pounds.
Yeah, I need to lose about 55.
Yeah. These viruses, let me tell you something, 55 is a lot, but let me tell you about these viruses. They live in fat cells. In other words, well, it's not the virus. It's the inflammatory cytokine. In other words, it's the body's reaction to the virus. They live in fat cells. And if you take away fat cells, then you're taking away the home where these viruses live. That's why these type 2 diabetics who are overweight, we call this a major comorbidity, where, an older type 2 diabetic, overweight status, these are the people that tend to get complications from the coronavirus.
Uh-oh, you're ringing my bell here, Doc.
Are you a type 2 diabetic?
Well, not yet, but I'm right on the verge, they said.
What's your fasting blood sugar or your hemoglobin A1C?
I don't know yet, but we can discuss that in the future. But
okay. I just got the spiritual connection to this program just now.
What's that?
This is the real reason why I'm on your program. It's for the audience, but also to help you.
Oh, yeah, without a doubt. USA Today, 911 calls for heart attacks tripled in New York City amid the COVID-19 outbreak. So how is this COVID thing, why is it giving people heart attacks?
I'll tell you why. Because the same receptors that are in the lung are in the heart, and basically the lungs and the heart share the same circulation. And they showed this over and over again. I mean, even in Wuhan, there was a study that came out of, I think there was about 420 patients. 19% of them had what we call myocarditis, inflammation of the heart, as they recovered from the pneumonia of the virus. And now there's been observational studies all over the world. In fact, even Germany just released one. It was in JAMA, the Journal of the American Heart Association. This came out on July 27th. That's only like 2 weeks ago. And this one observational study of 100 patients with documented COVID-19, only average age 50. This is a young person now, an average age 50. There was cardiac involvement in 78 of them. That's huge. That's like 78 out of 100 surviving the pneumonia had cardiac involvement, and what we call myocardial inflammation occurred in 60% of the patients. So this virus is sort of attacking the heart cells, like I mentioned before, in addition to the lung cells. And the problem with it is if you survive the pneumonia, which a lot of people do, by the way, I mean, let's face it, a lot of people, do get better. But now the possibility of cardiac involvement. So my plea to our listeners is this: if you did have the virus and now you have dreadful fatigue, or you have swelling of the ankles, or you have cough at night, this, like you're coughing at night, and it's not an infectious cough, but it's from, cardiac decompensation, call your doctor, let them know. And, the good news about the cardiac involvement is that a lot of these cases get better on their own, which is good news. But
well, that's good.
Remember, you can get arrhythmias, heart attacks, things like that, which is bad news.
Listen, we're about out of time. So, Dr. Sinatra, the title of your book is?
The title of the book? Well, there's a great cholesterol myth, is that book, and then that'll be coming out. That new edition will be coming out in October.
Okay, so again, the title is?
The Great Cholesterol Myth.
The Great Cholesterol Myth, and that's available on Amazon, everywhere else. Dr. Sinatra, I hope you'll come back on in the future. One final thing. What about, and we only have about 30 seconds, but what about Advil? They're warning not to take Advil, and yet it reduces inflammation.
Yeah, I would stay away from those nonsteroidals because they can make blood pressure worse, especially in females. So I don't like the nonsteroidal drugs. If you need an Advil or an aspirin or or a Tylenol, less is more. Remember that. Less is more. Do not get hooked on that kind of stuff.
All right, Dr. Sinatra, I hope we'll talk again soon. Thank you very much. Let's definitely make sure we do another interview when your revised edition comes out in the fall. All right?
Oh, yeah. Love to do it with you, Rhett. Great interview. Great questions.
Thank you, Dr. Sinatra. This is the Mayor of the Airwaves. You and I in a series of getting and staying healthy together with Dr. Sinatra today, cardiologist. We got to take a little break, and then we'll be back. It's not over yet.
Hi, I'm John Walsh. You may know me for the 25 years I've produced and hosted America's Most Wanted. Please, exercise your right to vote. In these challenging times, your vote is more important than ever. That's why I'm supporting Eric Flowers for sheriff. I believe he has what it takes to lead our sheriff's office now and in the future. Vote Eric Flowers for sheriff.
I know you want to have a beautiful smile. Well, an examination, radiographs, a healthy cleaning would normally be well over $200, gosh. Right now, for $79, you can call Plains Dental Arts, 231-6004. It's all included for $79. The examination, the radiographs, the healthy cleaning. Okay, call Plains Dental Arts. Make your appointment right now, 772-231-6004. Takes care of gingivitis, takes care of halitosis, gives you a great healthy smile. You get a thorough examination. Plains Dental Arts, just south of the Village Beach Market on A1A.